very new to male fertility. We're trying still to understand the exact use and add value of this indicator. We're gonna go over an overview today just to explain the basics of sperm, basics of fertility, and why we would bother by doing such tests that we has adopted at Legacy. So let's start first by reviewing some 101 of biology. So this is, I'm sharing my screen here. This is the structure of a sperm. So every sperm is very similar. They have basically a tail that will allow them to swim and propel from the external genitalia of the female into the cervix up to the uterus, all the way to the middle of the tubes, in the hope to meet an egg that's fertilized and form an embryo. And then we have this part here, the midsection of the sperm, which contain basically the mitochondria. You can think of the mitochondria as the engine of the sperm. It will give it energy for the flagellum or the tail to propel and swim upward. The most important part and structure of the sperm is basically the head. It has all the DNA content of this cell. So each sperm will have 3 billion base genetic information, which is like a huge amount if you think about it. It's around 750 megabits of digital information. So you can imagine, and this is contained in one single sperm. So you can imagine how fragile and important every sperm is for reproduction. So what's the function of a sperm? I think we all know it. The function of the sperm is to deliver an intact DNA information to the oocyte, which is the egg cell of the female. And for that, we need an intact chromatin, which is critical for the production of a viable pregnancy and the formation of an embryo. So you should think about the function of a sperm is basically to pass on the necessary biological information required to produce a new organism, a new embryo, a new baby. It's like a manual of instruction. So basically, this is the structure and the function of the sperm. And throughout the years, we had only very limited tests to make sure that we have a good structure, and some tests to test the function of the sperm. So how does the sperm fertilize an egg? Basically, we need to get to this image. It's a very nice 3D formed image where the sperm would enter the egg and fertilize it. What fertilization means is that the sperm should deliver the DNA content found in the head of the sperm and reach the egg nucleus right here. It's a very elaborate and complex process because one single sperm should hook up to the outer layer of the egg and then penetrate it through digestive enzymes. And then this sperm right here will deliver the DNA found in the head. The DNA found in the head should look up and reach the egg nucleus. And if this is successful, fertilization would happen. This is an oversimplification of the process. Actually, if you want to think about it, for this single sperm to reach the egg, it's like a marathon. So you would start with millions and millions of sperm, and then these sperm would have to travel different anatomical structure, such as the vagina, the cervix, the uterus. They would have to go through different temperature, different fluid pH and structure, and then finally to reach the egg for fertilization to happen. So for that, we need a healthy, viable sperm. Any structural deformity or any problem with the function of the sperm would make the probability of this sperm reaching the egg lower, and sometimes it will prevent it from altogether. So for a healthy, viable sperm, as we said, we need a good and normal structure, which is, for example, the head and the tail of the sperm. We need the sperm to be functional. So we need a good motility, we need the membrane to be intact, and we need a good and integral DNA. And this is the importance of DNA fragmentation. DNA fragmentation is basically one of the very few tests that will allow us to understand and look for any DNA fragmentation, which is any break in the DNA structure that's present within the nucleus of the sperm. Before doing that, nature itself, like Mother Nature, has its way into naturally selecting the very good and healthy sperm that is fit for the fertilization to occur. So you have different functions. So when you have millions of sperm going through the cervix, reaching the vagina, and then the uterus, and then going all the way into the tube of the female and reaching the eggs that's fertilized right here. Along the way, only the very fit sperm will reach this area. So if you start with millions of sperm right here, you're going to end up with thousands or even hundreds of sperm reaching the egg, and only one sperm will achieve fertilization. So the main and end goal for us is to have a successful pregnancy. And to have a successful pregnancy, we need multiple areas. So we need to have a good oocyte, a good quality. We need the endometrium of the female to be very receptive. We need the embryo after the fertilization happens to have a good quality. Most important, we need the sperm to be of a good quality. And as I mentioned, for the longest period, the quality of the sperm was only tested with a very single test that we all know, which is semen analysis or sperm analysis. But basically, we know now that semen analysis is only a very simplistic measure of the sperm quality and sperm structure. And it will only show us the tip of the iceberg. If you think about it, volume, count, concentration, morphology, and motility, these are all parameters that's shown by the semen analysis, and these are only very basic indicators. We now understand that we need to dig deeper into the quality of the sperm to understand why, for example, we have some unsuccessful IVF cycles, or why we have recurrent miscarriages. And this is the importance of DNA fragmentation test, because DNA fragmentation test will exactly tell us how much of the DNA in the sperm is intact. This is a nice slide that summarizes all the functional tests of a sperm. So we have multiple elements here, like it's a bit scientific, but just to mention them, like acrosome integrity, plasma membrane integrity, reactive oxygen species. But we're going to focus here on DNA integrity. DNA integrity means how intact is the DNA, how good is the DNA for it to fertilize properly an egg and make a healthy and a good quality embryo. So DNA fragmentation will test for these two, for double-stranded breaks in DNA and the single-strand break in the DNA. So this is the DNA that's found in the sperm, right? We have bases, genetic bases that codes for the DNA information, for the genetic information, and you can have all sorts of breaks, all sorts of mutation. So what DNA fragmentation will test for is the double-strand break and the single-strand breaks, which are the more common DNA integrity problems. What is this test? So this is the output of the test. You will have a slide that will be studied by an andrologist, who's the person responsible to process the semen sample. The semen sample will be treated with certain chemical and certain products, and then you will have the end product of this slide. So this is a non-fragmented DNA, which means that the DNA content of these two sperm will pass the test, and they are labeled as normal. If you have fragmented DNA, you will see this halo with less intensity and less clarity. And this will mean that these sperm have higher indices of DNA fragmentation test. And then we'll have the ratio of normal fragmented DNA versus abnormal fragmented DNA. And then we'll have a DNA fragmentation index. The cutoff of the DNA fragmentation index has been very variable among different studies and different references. We now know that around 30% is a normal DNA fragmentation index for a fertile male. Anything above 30%, we consider them to have a high DNA fragmentation index. You might ask me, what are the causes of this DNA fragmentation test? Why would it happen? It's a multifactorial process. Anything that would affect the sperm, for example, drugs like chemotherapy, if a person is a smoker, if he has any systemic diseases such as diabetes, cancer, if he has a recent infection, if he's very, if his work would project him to any pollution or radiation, then all of these factors will increase basically something called oxidative stress. Oxidative stress is a accumulation of all the toxins and the bad substance that would affect the DNA that we saw in this slide. So all these factors will cause an increase in these substances, in free radical oxygen, hydrogen peroxide, and hydrogen monoxide. These substances here will cause the breaks in the double-stranded and the single-stranded DNA. So when these environmental factor and systemic factor occurs, these substances will be more abundant. When they are more abundant, they will cause more oxidative stress, and then they will cause a dysfunction in the DNA by breaking dysfunction the sperm by breaking the DNA. I just wrote here some very common factors for increase in DNA fragmentation. The more common is the varicocele. Varicocele is a very common male factor in fertility condition that almost 1/3 of men will have it. It's a most common correctable causes because we have a way to treat varicocele by doing a simple operation. So if a guy has, for example, a high DNA fragmentation test and on physical exam he was found to have a varicocele, then he would be candidate for a varicocelectomy. Any fever or recent infection, whether viral or bacterial, would also cause an increased DNA fragmentation index. So for lifestyle, for example, if a person is a heavy smoker or heavy drinker of alcohol or heavy cannabis use, this will also increase the DNA because it will increase the oxidative stress. Aging is very interesting because we know that we have a decrease of 1% in semen parameters after the age of 40. So after the age of 40, each man will have lower quality and lower quantity of sperm by around 1% just because of aging, because aging itself would cause oxidative stress. So this is mainly the most common causes of oxidative stress that DNA fragmentation will reveal. So DNA fragmentation, you can think about it as a manifestation of other systemic and environmental factor that the person is having. How can we test for DNA fragmentation? So to test for DNA fragmentation, we have multiple tests. These are very different and very variable. Each one of them are very specific in their technique. Basically, they have a similar output. They will give us an index on how much a sperm or a sample is fragmented. And with this index, we can differentiate and certify the male and will tell them if they have a problem in their sperm DNA or not. So why we bother again with DNA fragmentation? Because multiple studies have shown that oligospermia, which is a low number of sperm, teratospermia, which is a low morphology of the sperm, and astenospermia is a low motility of the sperm. All of these are risk factor for male infertility. So if a person have low sperm, or if the sperm is not swimming as well, these men have been found to have elevated DNA fragmentation. Just to remind you that this is only a correlation. This does not mean if a person has a high DNA fragmentation index that he will necessarily have a lower number or lower quality. This is only a correlation, which is very important. In male infertility, we don't have basically a causation. It's only correlation, the association. So these poor semen parameters were only correlated with a high DNA fragmentation index. Some studies even didn't find any correlation, like these studies here on the right-hand side, didn't find any correlation between DNA fragmentation index and the poor semen parameters. However, as you can see, the number of the study on the left column is way higher. So this is why people are understanding and believing that DNA fragmentation index is a manifestation of a poor parameters, and this would have a lower probability for a man to conceive, either naturally or using assisted reproductive therapies, such as IVF or IUI. This is another important slide about the DNA correlation with pregnancy and assisted reproductive therapies, such as IVF or IUI. So all of these studies have found that an increase in DNA fragmentation index were very important in outcomes for pregnancy with IUI, for pregnancy with IVF or ICSI, or for recurrent miscarriages. So these studies are numerous and they consider a good level of evidence. The only drawback is that each one of them used a different cutoff point. But you can see the most they used was 30%, and this is why 30% is a recurrent number that you're going to see in different studies nowadays with more recent studies. Everyone is almost using 30% to differentiate between a normal DNA fragmentation index and a high DNA fragmentation index. So anything, again, above 30% is considered high, and this will put the man at a high risk of having fertility problem. These are also different studies. This one, it is a meta-analysis, which means they grouped most of the studies in the field. They include around 16 studies that looked at 3,000 couples, and their conclusion was that men with elevated DNA fragmentation index had an increased miscarriage rate by 2.16 times. So if you compare fertile couple with non-fertile couple who had high DNA fragmentation index had 2.16% times more chance of miscarriages than the normal fertile, which is double almost. It's a very impressive study. It was done in 2012. This is a similar study about people live birth rate. So they went through pregnancies and they studied how many pregnancies ended up with a live baby, with a live healthy baby. So they found out that people who had elevated DNA fragmentation index were really at a disadvantage compared to the normal people. This is also more evidence showing that if you have more than 30% sperm who have abnormal chromatin, which is a high DNA fragmentation test, the fertility is hampered, and it's independent of the sperm number, morphology, and motility. And this is very important, and this is pretty new, and there have been studies in 2018 and 2020 showing that even if a man has a normal parameter, normal volume, normal quantity, normal morphology, and motility, if they have a high DNA fragmentation index, despite having a normal semen parameter, the traditional one, they are at a disadvantage of having a successful natural conception. And this is why they divided the groups of men, even the fertile man, according to DNA fragmentation index fraction. So anything below 15%, they labeled them as excellent. Anything more than 30%, they were poor candidates. And this correlated exactly to the ability of achieving a pregnancy. So 84% of men with DNA fragmentation index less than 15%, who are the excellent group, achieved a pregnancy within the first 3 months. And 10% of men with DNA fragmentation index less than 30% took a bit more time, around 4 months to a year. But 20% of men with DNA fragmentation index more than 30% never achieved a pregnancy. And again, this is only a correlation. This does not mean that a man who has a high DNA fragmentation index would not be able to naturally conceive. This means that it may take some more time, or he might need some assisted reproductive therapies. This is only a correlation and an association. There is no direct link between DNA fragmentation index and pregnancy. It's only studies that it is only papers and science that studies the correlation. So just if you test yourself and they have a high DNA fragmentation test, it does not mean 100% that you're going to have difficulties and you're not going to be able to conceive. It means that you might be at a high risk of having male factor infertility and taking more time to conceive. Again, these are more studies about DNA fragmentation indices and the chance of pregnancy. So if you have a DNA fragmentation index of less than 27%, the chances for pregnancy are significantly higher than those who have more than 27%. And sperm DNA damage is associated with significantly increased risk of pregnancy loss after IVF and ICSI. So currently, DNA fragmentation is not part of the official guideline by the AUA or the ASRMs, which are the main bodies of fertility in the United States and globally. They are not part of the guidelines for a specific reason, because we don't have enough data or a good level of evidence or any causal relationship between this magic number of 30% and outcomes. We have only correlation. And usually for something or a test or a drug or anything, a medication or intervention, to go into these guidelines and to be recommended, they need to be proven. I think it's a matter of time. It will take a couple of years from now for us to prove that DNA fragmentation test is an essential factor and indicator to be used in the fertility field. But this test is currently being used, despite that it's not recommended, for very specific areas. For example, if we have a multiple failure of IVF cycles, we can use that. If we need to decide between when to do a varicocelectomy for a man, we would test the DNA fragmentation test. If we have a multiple recurrence miscarriages for a normal for a couple, then we test the DNA fragmentation test. If we have some of these scenarios, I think DNA fragmentation index will give us a huge amount of information and would direct us into a specific therapeutic management. I just put this slide just again to show you that most of the studies until now showed a correlation. Some of the studies that did not show any correlation or association. Like anytime you see a known stable, this means that DNA fragmentation test has not been associated with the embryo quality or with the chances of pregnancy. So basically, we're still trying to understand the DNA fragmentation test, despite the very good number of papers and scientific manuscripts showing us that there is something there and there is a correlation. So what can we do now? If we have a high DNA fragmentation index, let's say more than 30%, what can we do? Can we do anything at all? It's also a gray area, like everything in male fertility. We can use oral antioxidants. Oral antioxidant has been the subject of a big debate in the field. Many would recommend different over-the-counter nutrients, vitamins. We're still waiting for the good level of evidence and good data regarding this. The nice part of it, oral antioxidants have rarely side effects, except if you use them for a long period of time. So it won't harm anyone to use oral antioxidant if they have high DNA fragmentation index. The more probable evidence is for anti-inflammatory antibiotic to treat an infection. So if you have a male patient who has a high DNA fragmentation index and he was found to have a sexually transmitted disease, or he has like fever or an infection, that it makes sense to treat him with an anti-inflammatory and antibiotic. And we have many cases where we have DNA fragmentation index reaching 50%, and after treatment with antibiotic, they go down to normal levels. Treating the underlying medical condition, as I told you, for varicocele. If you have diabetes, it's important to control the diabetes. If you had cancer, or if you have cancer and you're taking subject to chemotherapy, then it's also important to take this into consideration, because we know that chemotherapy would increase the DNA fragmentation index. This will take time. Most of the cases, this is reversible. It just needs some time in some patients. Lifestyle modification is very similar to the antioxidant story. We have correlations with lifestyle modifications and a good DNA fragmentation index. Anything that's healthy for you is good for your sperm. If you sleep well, it's good for your sperm. If you eat well, if you refrain from sugars, fat, any additives and processed food, this is good for your sperm. If you exercise regularly, it's also good. These are all correlations. We don't have any exact science that links directly any lifestyle modification to good sperm health. There's no one can project that if you work 5 days a week, for sure you're gonna have good quality of sperm and good DNA fragmentation. So what can we do if all of these traditional therapeutic intervention fail at some point and we still have DNA fragmentation index? It's not the end of the story. We have found that sperm that were extracted from the testicle itself had way lower DNA fragmentation index than those that were ejaculated. And you can see here from this table, this is ejaculate sperm, and this is testicular sperm. So sperm taken after we did a surgery, we opened the testicle, we extracted some sperm directly from the testicle, from the factory, from the production. And you have found across the board that testicular sperm had way lower DNA fragmentation index compared to ejaculate sperm. So if a man or a couple are going through an IVF cycle and they have a high DNA fragmentation index and they did all of these therapeutic intervention and nothing worked, then there is still a chance to go and do a surgery and take the sperm that has a least chance of having a DNA fragmentation from the testicle itself. So DNA fragmentation, again, index in ejaculated sperm was found to be 3-fold higher compared to sperm extracted from the testes. And this is very important. This is guiding most of our surgery nowadays. And it will help us to decide when to go and rely on the sperm that was ejaculated and produced by masturbation, and when to go to the testicle and extract the sperm from there. This is my last slide. So the take-home messages are, first one, DNA fragmentation, it will give us superior information compared to regular and traditional semen analysis. Most likely, it's complementary and parallel in direction. If you have lower number and low motility, most likely you're going to have lower, higher sperm DNA fragmentation index, because they run in parallel. If there is a single factor that is causing the male factor infertility, it will affect both the quantity and the quality of the sperm. Second point is DNA fragmentation index is a reflection of oxidative stress. Anything that is bad for you is also bad for the sperm. Pollution, bad lifestyles, chemotherapy, any systemic disease, varicocele, anything that would increase the chances of having a male factor infertility risk would also increase the DNA fragmentation index, because it's only a reflection of a manifestation of that. Finally, in many studies, but not all, you have to stress on this point, elevated levels of DNA fragmentations are associated and correlated and not caused with poorer natural pregnancy rate, recurrent miscarriages, and poorer ART, which is IVF and IUI outcomes. So it's a marker of poorer outcome of regular and normal pregnancy rates and assisted reproductive therapies outcomes. So basically, this is it. I hope it wasn't too bad. I hope you have a small understanding about DNA fragmentation now.
Ramy, thank you. That was great. That was super informative. I know that I learned a ton. So we do have some questions that the attendees had submitted beforehand. So we'll go through a couple of those, and then just for the attendees here as well, if there's anything else that comes to mind that you are interested in learning about, feel free to put it in the chat box down in the lower right-hand corner of your screen, and hopefully we'll have time to get to a few of those as well. But so Ramy, I guess the first question that we have here is, and you touched on this in your presentation, but just to reiterate, you know, for those who have already gotten a sperm analysis done, either with Legacy or elsewhere, how important would you say it is to get information about their DNA fragmentation? Is that necessary, or are there like certain people or cases that you would suggest that that information be more important to?
It's a very good question. I think it's super important because the level of information that the DNA fragmentation test would give us is very different from the traditional semen analysis, right? The semen analysis would only show us the physical parameter of quantity. So if you have volume, number, concentration, motility, and morphology, these are more or less quantitative indicator of sperm and fertilization, whereas DNA fragmentation test is one of the few tests that would give us the quality and the DNA integrity. So I think they're both complementary. I'm almost positive that a couple of years down the line, these two tests would be as part of the same test, and everyone's going to be doing them.
I see. So right now, if one of you know, the attendees on the call were to go get a semen analysis done, it's not standard practice for the DNA fragmentation to be included in that.
No,
okay.
no. But personally, if a client has the financial means or he's interested in knowing more information, I think this test is of utmost importance. This test has been correlated with many important factors, such as recurrent miscarriages, the chances of natural pregnancies, the chances of a success of an IVF cycle, which are pretty important information for any couple going through this. Mm-hmm. So I personally think it's a very important test to have.
But so just to be clear, because I know that you are very adamant about making sure that people understand that this is all correlation or association, it's not a causal relationship. So DNA fragmentation, it's not going to tell you whether or not you can conceive naturally. It's not going to tell you whether or not a specific form of reproductive assistance is going to be successful. It's not going to tell you whether or not you and your partner are going to miscarry. It's just correlated with those outcomes. Is that correct?
Yeah, you know, this is my favorite point. Over and over again. Male factor infertility, fortunately and unfortunately, we don't have a high level of evidence to suggest any causality, right? Everything in male fertility, whether supplements, whether most of the things we deal with are only correlated and associated. So we have a positive correlation with DNA fragmentation and pregnancy loss and IVF failure. It's not a direct causes. And then again, this is the example I used during my presentation. If a man has a high DNA fragmentation index, this does not mean that he will have a problem or less probability of conceiving naturally. Or if they're going through IVF, he's going to have a cycle failure. This means that he has a higher chance of having a pregnancy loss, a higher chance or a probability of having to deal with miscarriages.
That's really good to know, and I think that that's something that we tried to make clear to our clients as well, which is just because you get your analysis back and the results are suboptimal, and you know, maybe some of the sperm parameters fall below the normal range, that doesn't necessarily mean that you are going to have trouble conceiving naturally. A semen analysis will not tell you whether or not you're able to get pregnant organically. It's just giving you a general kind of benchmark of your reproductive health. So I think at that point, what you said of association versus causation is really important to understand. So you mentioned, Ramy, oxidative stress and how that can cause DNA fragmentation. So would you suggest, and I know that there is a lot of people kind of have polarizing views about supplements, but would you suggest any specific types of supplements or antioxidants to help with that oxidative stress?
So as we talked about, oxidative stress is the main process by which DNA fragmentation would occur, right? So DNA Fragmentation Index is a manifestation of how much oxidative stress is happening inside of the sperm. The causes of oxidative stress are multiple and multifactorial, whether being systemic diseases or varicocele or lifestyle, they're multiple. Antioxidants are on the market and they're everywhere. They're being marketed as a magic drug and medication to decrease this oxidative stress. Actually, we have very, very limited information and data to recommend any specific vitamin or nutrients or any compound. The only very few studies that studied coenzyme Q10, that's CO enzyme, literally Q as in queen and 10, with the dose of 300 to 400 milligram per day. This is the only nutrient that's over the counter that has been shown in very limited studies to have a beneficial effect on quantity and morphology and motility of the sperm. So they showed that it was a very limited sample size by around, I think, 50 men. And they showed that men who took this supplement of coenzyme Q10 every day for at least 6 months had a bit of a higher semen parameters. And I say a bit because the improvement is going to be margin. It's not going to be a 50% improvement or an 80% improvement. It's going to range between 10 to 30% improvement. So even a small improvement in the quantity or the motility of the sperm is important, but it's not going to make a huge difference for people who have very low parameters.
Right.
So I cannot not recommend these supplements. There are like selenium, vitamin E, vitamin C, most of the vitamins like in a single pill. Just make sure that if a man wants to take these supplements, make sure that at least it has this coenzyme Q10 at 300 to 400 milligram to have the conscience clear that we have some evidence regarding this compound.
Great. Good to know. Okay, Ramy, so we have, it looks like time for maybe 2 more questions. So I'm just looking at the ones that were submitted here. I think the one that I'm seeing here that I think is super important and will help a lot of the listeners is asking about the amount of time of abstinence prior to producing a sample. I know that we here at Legacy recommend a specific number of days before producing the sample in order to have the best quality sample when we're analyzing. But what would be your recommendation for abstinence before getting tested for DNA fragmentation?
So abstinence is a really interesting thing. It's a double-edged sword, right? If you abstain for a very long time, which is more than 3 to 5 days, you'll have higher oxidative stress in the inside of the testicle, right? And when you produce the sperm, you're gonna have a higher DNA fragmentation index. The shorter the period of abstinence, the better outcomes for DNA fragmentation, for motility and morphology. The problem is if you abstain only for 1 day or less, the quantity is gonna be lower. So the sweet middle of these two is around 2 to 3 days. So the recommendation is to abstain for 2 full days and then produce a sample in the morning of the 3rd day. This will compromise a bit on the DNA fragmentation index, it will for sure increase it, because we know the more you wait and the more you abstain, you're going to have a higher DNA fragmentation index. But it will allow us to have some more quantity and concentration, which is also very important for fertilization. So I would suggest that this abstinence parameter be very individualized. For people who don't have any problem with their numbers and that only have a problem with DNA fragmentation index, then lower days of abstinence makes more sense. For people who have a bit of a lower concentration or low motility, then I think sticking to the 2 days makes more sense for them.
Okay, great. Good to know. Cool. So Ramy, one more question here. It's one that I really like and am interested in learning a little bit more about, which is, when you have a client or a patient come to you and they have high DNA fragmentation, what would be, and I know that it's case by case, but what is the kind of first step for you? Or for the patient really, but what's the thing that you look to first, and what would be your suggestion in terms of kind of course of action or treatment?
That's a very good question. So as we said, DNA fragmentation index has some clinical implication, right? If I have a patient with high DNA fragmentation index, I will first of all search for any treatable causes. I will do a physical exam to rule out any varicocele. I will ask about a reproductive history and make sure they don't have any lifestyle factors that is putting them at a high risk of having these oxidative stress. I would ask about smoking, about cannabis, about alcohol, about anything that will increase the temperature of the scrotum, such as jacuzzis or hot tubs. And then I will rule out any treatable causes for these DNA fragmentation index. If I don't find any, then it depends. If they're just here to check the fertility potential, then we're gonna wait until they try naturally and then see their chances of naturally conceiving. If they're going through an IVF or II cycle and they're having difficulty, then I will discuss with them doing the surgery and taking the sperm directly from the testicle rather than using the one from the ejaculate.
Gotcha. So it sounds like it's really case by case, and what you suggest is getting as much information as possible so that you have a more holistic view of all the information, including not only sperm analysis parameters, but also and DNA fragmentation index, but also any sort of medical history, any sort of kind of lifestyle behaviors, environmental things that may have impacted them as well.
Exactly that. The most important thing is to rule out any treatable causes for these DNA fragmentation tests. So if they have any infection or any varicocele or anything that we can change or treat, we'll do that first.
Right.
And then we'll take it case by case depending on the fertility treatment or therapies they're going through.
Great. Dr. Ghayda, that was wonderful. That was very educational, so I appreciate your time. We didn't get to everybody's questions, so I will make sure to personally email anybody who had submitted a question and we weren't able to address it. And then for anybody else who is in attendance tonight who has questions that may come up after we get off this call, you can feel free to email me directly and I will do my very best to get you the information that you're looking for. Again, my name is Sarah. You can email me at Sarah, it's SARAH at givelegacy.com. You can also respond to the email that you received for this presentation, which was from Dave. So that's Dave at givelegacy.com. And thank you all for joining. It was great, and we hope to do more of these info sessions in the upcoming months. What we'll likely do is have kind of a topic that we focus on, and we will do a different subject each month. So keep an eye out for more emails if that's something that you are interested in. Alrighty. Thanks, everybody. Dr. Ghayda, thank you again.
You're welcome. It was a pleasure.
Bye-bye.
Bye.